First-degree heart block occurs when there's delayed conduction through the atrioventricular node. Despite this delayed conduction, every atrial impulse leads to a ventricular contraction, meaning that on the ECG, every P wave is followed by a QRS complex. On an ECG, first-degree heart block presents as a PR interval greater than 0.2 seconds, which is 5 small squares or 1 big square. Second-degree heart block is where some atrial impulses do not make it through the atrial ventricular node to the ventricles. There are instances where P waves are not followed by QRS complexes. There are two types of second-degree heart block: Mobitz type 1, which is Wenckebach's phenomenon, and Mobitz type 2. Mobitz type 1, or Wenckebach's phenomenon, is where the conduction through the atrioventricular node takes progressively longer until finally it fails, after which it resets and the cycle restarts. So on an ECG, there's an increasing PR interval until a P wave is not followed by a QRS complex. The PR interval then returns to normal and the cycle repeats itself. Mobitz type 2 is where there's intermittent failure of conduction through the atrioventricular node